Hello. Please hit like button and subscribe my channel. Also press bell icon for future video notifications. Thanks.
Alyssa Johnsen, MD PhD Immune-mediated rheumatic disorders are complex chronic diseases that arise from multiple genetic and environmental factors. One understanding of the immune system has progressed dramatically during the last 2 decades, resulting in significantly improved advanced therapeutic effective therapies remain limited for diseases like systemic lupus erythematosus, SLE, Sjögren syndrome, SJS, and systemic sclerosis, SSC. Disease heterogeneity complicates diagnosis and treatment. Complexity in rheumatic disease diagnosis and treatment arises from the variability of disease etiologies and heterogeneity of presentation within each disease, confounding the ability to predict the degree of efficacy of a therapy for an Patients with certain immune-mediated rheumatic diseases are more likely to have family members with the same or different immune-mediated diseases, suggesting overlapping etiology, even when they show diverse clinical phenotypes. 3. If we can better understand the seminal immune pathways driving MAL. To tease out the contributions and interactions of multiple genetic and non-genetic risk factors in immune-mediated rheumatic diseases and to identify driving immune pathways, researchers often rely on genome-wide association studies, GWAS. One example of the power of modern analysis techniques is the development of new therapeutic options for PSA, a chronic, multifactorial, immune-mediated disease that can lead to a substantial decrease in quality of life. The severity of skin and joint symptoms in PSA patients varies and may involve painful skin plaques and inflammation of the joints and tendon and ligament attachment points. Thanks to these findings, inhibitors of this pathway are now approved for use in adult patients with PSA. Researchers are employing similar methods to uncover the seminal pathways driving even more heterogeneous immune-mediated rheumatic diseases, such as SLE, SJS and SSC. These disorders have few, if any, therapeutic options. By studying an immune pathway that is driving a rheumatic disease, we can generate distinct pathway insights that enable us to unlock the pathway's potential to treat patients. How do we find the seminal pathway for diseases that continue to be difficult to treat, like SLE, SJS and SSC? We will need to marry genetic and molecular techniques with state-of-the-art data science approaches. The role of data science in discovery and development. Data science aids drug discovery and development by improving target validation, patient selection, and predictive molecular, imaging, and digital endpoints. To advance knowledge of molecular drivers of pathogenesis and identify predictive biomarkers, scientists apply innovative data science approaches to large genetic data sets from multiple single-cell technologies. 6-mass cytometry also enables researchers to simultaneously detect multiple phenotypic. This shift from a one drug, one disease mentality to one drug, many diseases is a hallmark of Janssen's approach to developing medicines with the goal of transforming patient lives. Today, too many people living with immune-mediated rheumatic diseases continue to wait for science to deliver a disease and symptom-free life. My team and I at Janssen are committed to understanding the key pathways driving immune-mediated diseases. P. Chung et al. Single-cell technologies. Studying rheumatic diseases one cell at a time. Nat Rev Rheumatol, 15. 340-354, 2019. M. Luan et al. The shared and specific mechanism of 4 autoimmune diseases, Oncotarget, 8 to 108,355-108,374, 2017. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.